Serotonin Antagonist Reuptake Inhibitors, Saris. The prototype drug that blocks serotonin 2A and 2C receptors as well as serotonin reuptake is trazodone. Trazodone is another SARI with robust 5-HT2A and weaker 5-HT2C antagonistic properties as well as SERT inhibition, but is no longer commonly used because of liver toxicity. Trazodone is a very interesting agent since it acts like two different drugs depending upon the dose and the formulation. Different drug at different doses. Combined actions of 5-HT2A 2C antagonism with SERT inhibition only occur at moderate to high doses. Lower doses of trazodone are frequently used for the effective treatment of insomnia. These lower doses exploit its antagonistic actions at 5-HT2A, H1 and alpha-1 receptors. But these low doses does not adequately exploit its SERT and 5-HT2C inhibition properties. Since insomnia is one of the most frequent residual symptoms of depression, trazodone can augment the efficacy of other antidepressants. To get an antidepressant action though, the dose must be raised to recruit SERT inhibition, which raises the serotonin levels. However, what happens when trazodone raises serotonin levels is different from what happens when SSRI or SNRI does this, as these increase serotonin levels by acting at all the serotonin receptors, with therapeutic actions by stimulating 5-HT1A receptors and with side effects by concomitantly stimulating 5-HT2A and 2C receptors. That theoretically causes sexual dysfunction, insomnia and anxiety. But by trazodone, 5-HT1A receptors are stimulated by raising serotonin levels when SERT is inhibited, but 5-HT2A and 2C receptors are blocked. This pharmacological profile alters the clinical profile and explains why it is not associated with sexual dysfunction and insomnia, and in fact is a treatment option for insomnia and anxiety. The same clinical profile applies to other agents with 5-HT2A antagonistic properties such as atypical antipsychotics and mirtazapine. Also, the combination of 5-HT2A antagonism with 5-HT1A stimulation causes enhancement of both glutamate and dopamine release downstream. Different drug in different formulations. Trazodone is not commonly used at high doses as an antidepressant because it has a short half-life requiring multiple daily doses and can be very sedating at antidepressant dosing levels. It comes in immediate release as well as various controlled release formulations. The immediate release formulation has a relatively rapid onset and short duration of action, and in low doses acts as hypnotic, but wearing off before the morning so that there is no hangover effect. But as can be expected at higher antidepressant doses, there can be hangover effect in the morning. Higher doses of controlled release formulations given once daily at night do not attain sedating peak levels of the immediate release and thus are antidepressants without sedation. These properties of trazodone added to SSRIs and SNRIs are likely not only to boost the efficacy of these in depression and anxiety, but also have more than a hypnotic effect.